Welcome to this video on oxygen cylinders, regulators, and flow meters. We'll cover the key parts and safe use of oxygen cylinders. These cylinders provide essential oxygen therapy in many medical settings, supporting patients with breathing difficulties during surgeries and in emergencies.
We will cover 5 key topics in this video. Identifying the components of oxygen cylinders, ensuring safety measures, demonstrating proper usage of regulators and flow meters, adjusting flow rates to meet medical needs, exploring medical applications.
Identifying components. An oxygen cylinder is a pressurized vessel containing medical-grade oxygen, and it has several important parts. Cylinder stores compressed medical-grade oxygen, made of aluminum or steel, available in various sizes. Valve controls oxygen release, opens slowly to prevent pressure damage. Pressure regulator reduces high cylinder pressure to a manageable level. Flow meter adjusts oxygen flow rate in liters per minute. Humidifier bottle adds moisture to oxygen, preventing respiratory dryness.
Ensuring safety. When handling oxygen cylinders, safety is paramount. Here are several key measures. Proper storage. Store cylinders upright in cool, ventilated areas, away from heat or flames. Careful handling. Use trolleys to move cylinders. Avoid dropping them to prevent accidents. Leak prevention. Ensure tight connections between the cylinder and regulator to avoid leaks. Avoid contamination. Keep cylinders away from oils, grease, or flammable substances to prevent ignition. Regular replacement. Monitor oxygen levels and replace empty cylinders promptly.
Demonstrating usage. Here's how to properly set up and use an oxygen cylinder. Connecting the regulator. Attach the regulator to the valve of the cylinder by ensuring a tight seal. Turn the valve slowly to release oxygen. Flow meter adjustment. Adjust the flow meter to the required flow rate, typically between 1 to 15 Lmin depending on the patient's oxygen needs. Attaching tubing. Connect the nasal cannula or mask to the flow meter outlet and ensure there's no kinking in the tubing.
Adjusting flow rates. Reading and adjusting flow rates is crucial in ensuring the patient receives the correct oxygen dose. Low flow rates for patients with mild respiratory issues. Medium flow rates, commonly used for moderate oxygen supplementation. High flow rates, necessary for severe respiratory distress or emergencies. Make sure to monitor the flow meter regularly to maintain consistent flow.
Medical applications. Oxygen cylinders are widely used in healthcare settings, including emergency rooms, to provide immediate oxygen to patients with trauma, cardiac arrest, or respiratory failure. Surgical procedures. Oxygen is administered during anesthesia to ensure patients maintain adequate oxygenation. Home care. Patients with chronic respiratory conditions, such as COPD, may require home oxygen therapy for daily use. Ambulances, used for patient transport to provide essential life support en route to the hospital.
This video covered the essential components, safety procedures, and medical applications of oxygen cylinders. By following these guidelines and maintaining proper usage, oxygen cylinders can continue to provide critical respiratory support to patients in need. At Imam Abdul Rahman bin Faisal University, we emphasize the importance of medical safety and best practices in healthcare.
This video was designed under the supervision of Dr. Safan Al-Safadi and Dr. Nada Sami by Huda Abdurrahman Al-Warthan, Arij Sami Al-Amr, Dua Fadl Al-Nazal, Razan Hassan Al-Shimmari, Inas Fahd Al-Haddad.